Intro 000. Have you ever looked into the toilet and noticed that your urine was unusually foamy? Maybe it happened once. Maybe it happens almost every day. Should you be worried? The good news is that foamy urine is often harmless. But in some cases, it can be an early warning sign that your kidneys aren't working properly. In this video, I'll explain the 6 most common causes of foamy urine, when you should see a doctor, and which warning signs you should never ignore. Let's get started. Cause number 1, you're peeing too fast, 045. Believe it or not, the most common cause of foamy urine is completely harmless. If your bladder is very full, your urine leaves the body with greater force. Just like water from a faucet creates bubbles when it hits the sink, fast-moving urine can create foam in the toilet. This type of foam usually disappears within a few minutes, only happens occasionally, and isn't accompanied by any other symptoms. If that's the case, there's usually nothing to worry about. Cause number 2, dehydration, 2. Not drinking enough water is another very common reason. When you're dehydrated, your urine becomes much more concentrated. Concentrated urine contains higher amounts of waste products, making bubbles more likely to form. You may also notice dark yellow urine, a strong smell, dry mouth, or feeling tired. The solution is simple. Drink enough water throughout the day and see whether the foam disappears over the next day or two. Cause number 3, protein in the urine, proteinuria, 315. Now we're getting to a cause that deserves more attention. Healthy kidneys act like very fine filters. They keep important proteins inside your bloodstream while removing waste products. If those filters become damaged, protein can leak into the urine. Protein changes the surface tension of urine, making it much foamier. Unlike harmless bubbles, protein-related foam often appears repeatedly, lasts longer, and may occur almost every time you urinate. Protein in the urine isn't a disease itself. It's a sign that something may be affecting your kidneys. Cause number 4, kidney disease, 450. One of the most important causes of persistent foamy urine is kidney disease. Conditions such as diabetes, high blood pressure, certain autoimmune diseases, or chronic kidney disease can damage the kidney's filtering units. Early kidney disease often causes no pain at all. Foamy urine may actually be one of the first noticeable symptoms. Other warning signs include swelling of the ankles, swelling around the eyes, high blood pressure, fatigue, or blood in the urine. If you notice persistent foamy urine, your doctor can easily check your urine for protein with a simple urine test. Cause 5, urinary tract infection, 630. Although less common, urinary tract infections can also make urine appear foamy. This happens because bacteria, white blood cells, mucus, and inflammatory proteins mix with the urine. Typical symptoms include burning while urinating, frequent urination, cloudy urine, bad-smelling urine, or lower abdominal pain. If you have foamy urine together with these symptoms, a urinary tract infection should be considered. Cause number 6, semen in the urine, retrograde ejaculation, 745. In men, there's another possible explanation. Sometimes small amounts of semen mix with the urine. This may happen shortly after ejaculation, after prostate surgery, or in men with a condition called retrograde ejaculation. Because semen contains proteins, it can temporarily make urine appear foamy. This is usually harmless and disappears on its own. When should you see a doctor? Or 845. Occasional foamy urine usually isn't an emergency. However, you should see a healthcare professional if the foam occurs almost every day, it doesn't disappear, you notice swelling, you have blood in your urine, you have high blood pressure, you have diabetes, or you feel unusually tired. A simple urine sample can often determine whether protein is present. Your doctor may also recommend blood tests or an ultrasound of the kidneys if needed. Can you prevent foamy urine? 950. Not every cause can be prevented, but you can lower your risk of kidney problems by drinking enough water, controlling your blood pressure, keeping diabetes well managed, avoiding smoking, maintaining a healthy weight, and seeing your doctor for regular checkups if you have risk factors. Healthy kidneys are incredibly important and often taken for granted until something goes wrong. Conclusion, 1045. Foamy urine is surprisingly common. In many cases, it's simply caused by fast urination or mild dehydration. But if it happens repeatedly, especially together with swelling, fatigue, or blood in the urine, it could be an early sign of kidney disease. The good news is that a simple urine test can often provide the answer. So don't panic, but don't ignore persistent foamy urine either. If you found this video helpful, please like, subscribe, and turn on notifications for more evidence-based videos about urology and urinary health. Thanks for watching, and I'll see you in the next video.